So tell me your full name and designation, please.
Yeah.
Yeah.
Okay, I'm Leonard Surage. My qualification, I have a bachelor's degree in medicine and surgery from UWI, University of West Indies. And I did a fellowship at the Royal College of Surgeons, a fellow of the Royal College of Surgeons in Scotland, 1991. And returned home. While I'm home, I've gotten a few awards and this and that, among which was an OBE from the Queen about a few years ago. And I am currently, I was the only ENT surgeon for about 30 years. And very recently we were joined by another colleague from the south as well. So my main profession is ENT surgery. I'm also dabbling in other things, like I'm doing farming, I run a sleep lab, and so forth.
And you've been with Tapia Hospital for how long?
For as long as it has existed, because I'm part of the formation and development of Tapia Hospital.
So give us an idea, as much as possible, please answer in complete sentences because only your voice shall be heard.
Okay.
Yep. Give us an idea of what happened here today.
Today is an important day for the development of health services and certainly surgery in Tapia. We did an operation to somebody who had been having recurrent air problem, and a procedure, a very new procedure, which is being done by ENT surgeons, not all ENT surgeons. And that procedure is called balloon sinuplasty. It is to take care of sinus issues as well as middle ear issues as it relates to the malfunctioning of the eustachian tube. I have to tell you a little bit of the background of what is the eustachian tube and so forth and the function of the middle ear. The eustachian tube basically is a tube that connects the nose to the middle ear to ensure that the middle ear pressure is the same as the outer air pressure. Because if you have any vibrating system like a drum, the pressure on both sides must be the same for maximum movement of that drum. And in St. Lucia and the Caribbean at large, we have a lot of problem with the eustachian tube not functioning properly because of many reasons. Some can be the tube may be predisposed to blockage because of the shape of it. It could also be from infection, from allergies, from other issues, and even short-term issues like working in a very dusty environment. The tube you inhale the particles or the allergens, and the tube gets swollen, the tube gets blocked, and you get problem with eustachian tube malfunctioning and middle ear issue. So sometimes medication can take care of that, but there are some group of people that no matter what you do, it keep on recurring. And so the balloon sinuplasty, a new invention that is available to the ENT fraternity. So this is now available, and some physicians, some ENT surgeons do it. And so in today's event, I had to recruit my colleague from Atlanta. He's an ENT specialist. And we work quite closely because we've been doing surgery for many, many years, 15 years or so. He comes to St. Lucia and we do work. But he is very much into the balloon sinuplasty. And so I invited him to come to St. Lucia and let us do this procedure on a particular patient who have a recurrent air problem.
And tell me of any complications today, tell me of the recovery process, and whether the surgery itself was a success?
The success of the surgery will be determined as the patient recovers and so forth. But we believe that after a bit of a challenge in terms of patient had a cold before, and therefore there was still a lot of mucus, a lot of friable or very delicate tissue in the back, which actually made it a little more challenging to identify where the eustachian tube was located, and then to cannulate it, and then to do the balloon treatment for it. So, but eventually we got it done on both sides. Usually, whatever I see on one side may usually mirror images the other side. So we're able to do it quite comfortably. And so that, I expect that when she recovers, her hearing might improve, which we're hoping, and that within a week or 10 days she should be recovered.
And so we noticed that, yes, you were on both ears, but you also went through the nasal passage.
Yeah. The nasal passage is exactly where the eustachian tube is located. The tube is located in the back of the nasal cavity and back part of it. And so we have to identify it from the nose. Usually when you look at somebody's nose, you tend not to see beyond, say, 1.5 to 2 inches, 1.5 inches. But this is located almost like 2.5 to 3 inches from the tip of the nose. And therefore you need to have special equipment to identify it, either through a headlight and you shine the light into the nose, and you have a speculum that will open the fleshy part of the tissue and you can see. Or you can have a scope, an endoscope, which is called a Hopkins rods endoscope, that you put into the nose and then you can identify it. And you have a special cannula that cannulates the tube, the eustachian tube. So yes, we enter through the nose to get to the eustachian tube.
Over the last, say, 6 months to, I guess, October will make it a year, we've seen a gradual shift in the new approaches, new surgeries being performed at Tapio Hospital. Yours being, you've done it before, but it seems the practice is increasing.
Yeah.
Why and how has Tapio gotten to this point to offer first world of care to small island savings?
To satisfactorily answer your question, I would have to go back at the philosophy of the establishment of Tapio Hospital. Tapio Hospital was set up by a group of St. Lucian doctors and doctors working in St. Lucia. And all of them have been specialists who have been trained outside of St. Lucia and returned home either by invitation, those who were not St. Lucian, and local St. Lucian who really wanted to return home to make a difference in the healthcare landscape. And so we, having been trained to practice in a certain way, at a certain level, found it difficult to do so because the environment in which we were operating was not responding to the demands and the standards that we aspire to. We could have easily remained in our first world country and enjoy the quality of life there and do well. But we came to St. Lucia and felt that we wanted to make a difference. So we, having realized that the hospital that we were working in were not rising to the standard that we were trained to deliver. And I can tell you that if you didn't know how to do something, you can do it badly and don't feel anyway. But if you were trained to do it in a certain way and finding yourself doing it below standard, it actually hurts you. So therefore, felt there are two options. Either we migrate out and practice the skills as we know how to practice it, or that we can stay and have a joint venture develop a hospital and practice in the way that we feel we should practice. So you can see that the group that started it were the same group that were pressing for changes, pressing for standards, pressing for increases in quality care, and they're the ones that went ahead and do other training courses and expand their own knowledge. So it is not unusual to see that if Tapia was born out of that particular philosophy, then it would continue to grow if it had the financial resources to grow. So Tapia gradually grew, and many of the specialists, though working for both government and at Tapia, we continued to raise the standard. And of course, all of us are Caribbean doctors, and we have Caribbean affiliation. And it was not very difficult for us to have actually bring in our colleagues to assist. So we saw Tapia, also looking at the tourist industry, we saw Tapia as an addition to the quality of service that's being offered. And seeing the tourist industry is moving, and especially dialysis and a few other areas where people were actually looking for these services before they booked their ticket to come. So we expanded in these areas, and we thought that by having a hospital like Tapia, we can actually improve the tourist product. So these are the reasons. And of course, we have maintained connection with our trainees and other people overseas, so we can bring them, we can increase the quality of service by having these people to come to work in St. Lucia on a visitation basis. I've always felt that, personally, that the technocrats precede the technology. And therefore, if we want things to happen, we invite our friends, and then we press for higher standards.
As it relates to our neighbors, Grenada, you said, doesn't have an ENT.
No.
Dominica?
Dominica has one, but he's not working with the government.
Okay. So if you had to speak to our colleagues, your colleagues, not your colleagues, potential patients throughout the region who are not sure about the capabilities here, especially when it comes to ENT, what would you say to them?
I would say that we have a fairly well ENT services, very good in ENT service in St. Lucia. And not only St. Lucia, I can say that Barbados have a very good service, Trinidad has, St. Vincent have one ENT just like St. Lucia. Dominica has one, as you mentioned, but not available to the general public. So I think that, and we have 2 ENT surgeons in St. Lucia, and I think we are well equipped to do most of the work that can be done. Reasonably expect our ENT surgeon in these parts. Yeah.
Is there anything I forgot to ask that you'd like to add?
What I would like to say is that there is the doctors that work at Tapia are fairly well knit. They communicate well. We rely on each other for our resources. So when you come and visit one doctor, you have access to all the other doctors under the same roof. Maybe not on the same day, but and also many a times we pull out the resources of other doctors and give it to you in the consultation. While I'm talking to you for a particular problem, I may decide to call one of my colleagues and say, well, what do you think of this? I have a patient who have ABC. So I can get a consult for you. So we have that kind of relationship, especially more recently having set the GP clinic, a general practice clinic. And so they get a lot of support from the specialists who are in-house here. That's number one. Number two, I would also like to say that Tapia is a different model. It's a mall concept that all of us rent from Tapia. We're not paid by Tapia. So the business model is one whereby tap your rent to us, we pay them their rent, and we use the service of the facility, etc. And like all private hospitals, we are being held to a higher standard, and therefore there is a far higher expense if you have to insure yourself against everything. And so there are a lot of hidden costs that are incurred that are not very visible to the average public.
Tell me your full name one more time.
My name is Leonard Surage. I'm St. Lucian.
And I knew your Leonard was a little funny, so spell it for us, please.
Leonard. The O is silent. I used to call myself Leonard, and until Mr. Walker, who is a educationalist, tell me the O is silent. Leonard is my name.
Leonard Surage. Thank you very much, sir.
Okay, thank you.
Do we interview your young man?
Yep, I'll call him.